They did. And so, I started to see that in the hospital system. And I started to ask questions. Maybe they didn't know. Maybe what would happen if I said something? And they labeled me a disruptive physician. It didn't turn out so well. And the last straw, actually, I had been complaining about things. And the last straw was I wrote, this patient that's being admitted to our service, I wrote this in the electronic medical record, has been on a proton pump inhibitor called Prevacid for 8 years, when the package insert clearly says 6 months to 1 year. And I wrote that in the chart. And the primary care doctor, who was an outpatient doctor, called the lead hospitalist to complain about me and said she's a liability rather than him being the liability for the medication he had this patient on for years. And they set me down and they said, listen, if you don't stop doing this, you can't work for us. And I'm kind of knee-jerk reactive sometimes, especially when I don't feel the ethics align with me. And I said, okay, I quit.